Hello, everyone, and welcome to this audio podcast. This audio podcast as part of the research and presentation series or edition, and this audio podcast series edition as part of a ZtormLabostix a ZtormLabostix production. So today we're looking at sort of continue the theme, if you like, in around healthcare, chronic kidney disease, and young people. This audio podcast will look at service evaluation or healthcare service evaluation in young people for young people with chronic kidney disease, and this is from peer-reviewed and published works from in around 2018, and toward the latter part of the review, there is a slide that gives that provides the citation, the reference or citation. To begin with, some contents. So a bit of background. I look at young people's care. Look at aims and objectives. Look at literature. Look at sort of literature and the challenges. Some of the challenges. Looking at epidemiology, looking at enhanced CKD service evaluation, looking at healthcare networks, looking at awareness through social media, looking at this sort of a discussion and implications for practice, conclusion, and then the sort of reference or the citation. So to begin with, a bit of background. So chronic kidney disease, or CKD, is a long-standing condition or long-term condition in which a reduced renal function is evident, and/or damaged damaged kidneys are unable to filter blood to achieve normal physiology. And with a growing aging population, CKD is evidenced, or has been evidenced, as a public health concern, but in between sort of evidences and literature, it has been documented as a public health concern, but also in as far as much as a major sort of public health concern. And whilst society may, on the one hand, value treatment priority for young people, a more thorough evidence base is needed or required. Primary care networks build on sort of core of current primary care services, and seek to prompt a greater provision of proactive, personalized, and coordinated, and more unified healthcare services. Clinicians at the same time describe this as development from relatively providing appointments from relatively providing appointments to proactively care for patients, care for CKD patients at primary care level. So, for example, a review had found allied health professionals, or AHPs, face diverse encounters dealing with multi-morbidity, including overcoming polypharmacy, challenges caused by fragmented healthcare services, and amongst technology and barriers to shared decision making in the provision of patient-centric and complex shared decision making in the provision of patient-centric care, and the complexity in following various or varying clinical practice guidelines. So now looking at some of the evidence in context of young people's care. So the present backdrop of young people's care is sort of defined by collaborations between tertiary centres and other NHS and other NHS trusts. And before continuing on, listeners and viewers, to inform that this works looks and delves into context from in context of National Health Service (NHS), but at the same time where healthcare services for young people in amongst the literature that has been cited or documented or is evidenced is of representation. So at the same time, where there can be defined collaborations between tertiary centre and other NHS trusts or National Health Service trusts providing young people services within a geographically defined area. A report that had been developed by the British Association of Paediatric Nephrology, BAPN, sort of retrospectively from 2009, of tertiary centres and general paediatricians identified that where the survey had informed that the current that at the time and present 13 tertiary centres that receive pediatrics or young people from varying into the nephrology or renal specialty. There is the patient population. The patient population in line to healthcare services can vary from over to where young people suspect or high risk for different forms of chronic kidney disease can be or are referred from over 200 pediatric departments, and each center related to between 7 to 20 hospitals. At the same time, it has proved challenging to assess sort of the cost effectiveness of the younger CKD populations due to the lack of data that would typically populate our economic evaluations. And listeners and viewers would be aware, hopefully, that most economic evaluations tend to unfortunately sort of focus on adult populations, and whilst pediatrics and young people are a minority population, this does not make them any less a priority or any less of value. So now looking at some aims and objectives around this works. So this overview, the aims and objectives here to highlight that the thoughtful investment in the care for young people with CKD, chronic kidney disease, is required. And this overview also looks to present some selected retrospective data, if you like, from the UK Renal Registry or UKRR, to investigate how service evaluation health service evaluation and pediatric health practices can be enhanced through a better understanding of clinical care networks. So now looking at some of the challenges and where some of the challenges in the context of the literature. So whilst most tertiary pediatric nephrology specialisms or centers do have a system or systems of outreach clinics. For example, the quality of service and the degree of involvement of local pediatricians and allied health professionals or AHPs varies. It was reported or has been reported that outreach clinics are undertaken in approximately 83% of NHS trusts providing young people services, and some tertiary centres hold clinics in all hospitals in all hospitals in locality, and whilst others who hold clinics in any hospital in any sort of hospitals. Approximately 60% of centers have identified a clinical lead for pediatric nephrology, and 22%, around 22%, although having no clinical leads, do have outreach clinics. However, approximately 8 or 18% or thereabouts of centers have no formal links with center, having neither a local lead nor any outreach service or healthcare service. This therefore causes issues in the care of younger and the pediatric patients who are patients and young people who are or can be distant to healthcare sites. So now looking at some of the epidemiology, if you like, around some retrospective data from the UKRR on pediatrics and young people. So a total of at the time a total of 917 excuse me, a total of 917 young people under the age of 18 years with diagnosed with ESKD or end-stage kidney disease were receiving treatment at pediatric nephrology sites or centers in around 2014. At the census data, the 80% of patients aged 18 years, for example, had been identified as having a functioning transplant, a functioning solid organ transplant. 11.2%, around 11.2%, or just over 11% were identified as receiving hemodialysis, a form of KRT or kidney replacement therapy, and were receiving specifically hemodialysis, and around just over 9.5% had also been receiving peritoneal dialysis, another form of KRT, and amongst patients aged 16 years at the age of 16 years, and prevalence where prevalence of end-stage kidney disease was just over 16 per million age-related population. At the same time, in the UK around 2013, around 2013. The prevalence rate of rate of treated end-stage kidney disease, or ASKD, in young people aged under 16 years was around 58.2 per million per million age-related population, and the incidence rate was around just over nine per nine just over 9 per million age-related population, and there were just around there were in around 1,000 just over 1,600 young people under age 16 years of age that had received kidney replacement therapy, or KRT, that is or was hemodialysis, in or kidney transplant or kidney transplantation in the United Kingdom between 1999 and 2014. Demographic data, or data for young people under the age of 16 years of age over the duration revealed that 547 patients or recipients reported to pediatric registry between 1999 and 2002, and secondly, 1,000 and secondly 596 between 2003 and 2007 and 3,579 between the years of 2008 to 2012. So comparing a 5-year duration for the two previous 5-year durations that have been that had an increase in the number of young people treated with a form of KRT, particularly in the pediatric population, particularly in the pediatric young population, had been evidenced as being under 2 years of age, being evidenced as under 2 years of age. UKRR data also informed that 891 young people under the age of 16 years of age were receiving KRT KRT in the UK in around 2013, and the UKRR data highlight that CKD is or has been becoming an increasing issue in young people, and there is a requirement, or there is a need for a service evaluation to address concerns. So now looking at sort of enhanced CKD service evaluation and as part of the literature. So At present, there has been fragmentation of services between centres where one centre may provide most young people services for CKD, whilst another may only provide limited services. The delivery the sorry the care the delivery or care of healthcare services or sorry the delivery of healthcare services or the implementation of healthcare services can depend somewhat on where a young person on where um, a young person's perspectives where a young person's perspectives is reflected by investment priorities of that area, making it a challenge for young people to receive the best healthcare possible. Acute kidney injury at the same time, or a KI, for example, has affected more than 1 in 5 emergency hospital admissions. AKI survival rates have improved in the young population over the years, from 9 out of every 100 in 1999 to 2003 to 18 out of every 100 in 2019 to 2013. However, a service evaluation could help save up to 105 million adult and young lives per year globally. Some pediatric renal services reported high incidences of reflux, obstructive uropathy, and glomerular disease. These were some of the most common sort of renal etiologies in young patients and young people's age 16 years old, 16 years old or 16 years old and diagnosed with CKD. The account accounted for 62 around just over 62% of all patients for whom primary diagnosis had been reported. There are significantly lower rates of preemptive transplantation in females. In females and ethnic minorities, and further investigations will be of importance. So now looking at healthcare networks. So clinical networks increasingly seen as structures which can help the NHS provide sort of the best care for young people services, and to enable professionals or health professionals to rise above the challenges in meeting high quality healthcare delivery in resource limited systems. Furthermore, in the intricate dynamics of public service commissioning, it has been increasingly recognized that more formal network arrangements are required. It is quintessential that explicit connections and accountability are rooted in governance, to reduce risk and achieve safer services with better outcomes, particularly when working across resource limited populations. And due to the cost of care provided for young people, informed high quality services and preparing to change future demands will help enhance practices. There needs to be an investigation services for young people. Networks are needed to integrate. So networks also are required to integrate. So any governance and healthcare structures involved will help professionals excuse me, will help professionals who have an understanding to also reduce risk and again achieve safer services with better outcomes and again in amongst young people. So it is also therefore important to also important it is also therefore important that all that all NHS trusts, for example, is providing pediatrics and children's services or young people's services have defined links to tertiary centres for support and advice so that a nominated physician or consultant in around pediatrics provides a lead for that link line to primary care. So now looking at awareness through social media. So our social media has various advantages over standard forms of attaining information relating to disease or diseases. Social media may have may help. Social media may help involve young people, and may help involve young people. Young people in, for example, updating healthcare service provisions for young people's services. Social media at the same time offers patients and professionals opportunity where service providers and investigators or researchers can form professional partnerships with a sort of a view to co-develop efforts in a way that has not been done that has not been done previously or evidenced historically, at least in line to pediatrics and young people services. So at the same time, in addition to generic, in addition to older people's CKD, tertiary in addition to CKD literature made available or that is available. Social media also allows a sort of streaming of media through a video or vlogs or blogs and through podcasts and audios for and by people who are for and by people who that have mutual objectives. Tech or technology also relies on a network of enablers and investigators where connectivity as well as connectivity as well as communities where online communities to help disseminate information information. And although social media has historically been considered been considered considered as a general recreational tool, it is increasingly used. It is increasingly used for awareness, research, and to encourage sort of best practices in healthcare services. Examples of social media works surrounding practice excellence, for example, are social media platforms such as the Renal Patient Support Group, the RPSG, since 2009, and the Kidney Disease and Renal Support Group, or KDARS group for kids, since 2014. Since 2014, where service providers and healthcare service users sort of participate in discussions, discussion threads, and share lived experiences. So now looking at some of the discussion around this works, there needs to be a focus which will sustain services for young people. The geography and local resources of and for young people generally need to be taken into consideration when deciding upon how to deliver services. A few sites providing young people's care maybe in the same city as or a very short journey away from a pediatric renal sites. So the most appropriate use of resources may be for all nephrology care to be available between primary and tertiary centres. Services for young people should also be enhanced using tech such as web portals and social media to enhance clinical practices. For example, in around pathology and laboratory diagnostic services. So some implications for practice. The numbers of renal centres in the United Kingdom, for example, are limited. So there are challenges surrounding expertise. Whilst most of the expertise is concentrated in hospital environs, it is essential that services are evaluated more holistically to ensure best practice and is optimized for young people, for young CKD patients, and to support care whilst providing the highest standard. At the same time, the pediatric nephrology. At the same time, the pediatric nephrology specialists or pediatric nephrologist specialists recognize the need of to invest in staff time and training for this to be achieved. So now looking at the conclusion. So because social media, mobile and device technologies are pulsating, this should also prompt healthcare professionals and patients, parents and guardians to interact in more immediate ways, advancing renal services for young people with CKD. The slide here, listeners and viewers, just provides the or gives the reference where the full overview of this works is peer reviewed and published and should be accessible in on social media. There will be the citational reference will be on social media for listeners and viewers to check out in at their own times. And so that draws this audio podcast to a close. This audio podcast is part of a research and presentation series audition. This audio podcast as part of a ZtormLabostix production. In this audio podcast, as part of works in regard to in regard to healthcare and young people's services from peer-reviewed and published works from 2000, from adapted and adapted works from adapted sort of overview from peer-reviewed and published works from 2018. Thank you.